What is birth control for in your IVF cycle? So a lot of people feel like it's counterproductive, it's counterintuitive to use birth control when they're trying to preserve their fertility or they're trying to conceive. But what birth control does is it kind of resets your system. It lets us kind of suppress everything, shut it off. That way, when we start your medications, you're having the response that we want in a very controlled environment. So that's why we use birth control. We also use birth control in instances where patients want to work around, travel or any sort of scheduling restrictions that they have. We can use birth control to manipulate when they'll get their period to go ahead and start the IVF medications. How many days are you typically on the birth control pill before starting your IVF cycle? This again depends on your protocol. Most doctors prefer to have you on it somewhere at a minimum of 7 to 8 days, and then up to 14 days maybe, again depending on your scheduling. If you're going to be away and we're doing it for longer, that's fine. They usually don't have a maximum, but they do usually have a certain requirement, like 7 or 8 days is the minimum that they'd like for you to take for it to take the full effect. Birth control is typically taken via an oral tablet. So it's just one oral tablet. Typically we advise to take it in the evening, but as long as it's being taken orally around the same time every day. Side effects of the birth control pill can include skin changes, bloating, headache. Essentially, most birth controls are estrogen based. And so that's why you kind of get those kinds of symptoms of the headache. Nausea is another one that we hear. Breast tenderness. These are all very common side effects of the birth control pill. Typically, when you're on it on a short course, we don't hear, that many complaints, but it is definitely possible.